First aid in respiratory failure. Symptoms. People having breathing difficulty will often look uncomfortable. They may be breathing rapidly, unable to breathe, lying down and need to sit up to breathe, very anxious and agitated, sleepy or confused. Um, Following symptoms may be present: dizziness or lightheadedness, pain, fever, cough, nausea, vomiting, bluish lips, fingers and fingernails. Following steps must be taken when we suspect respiratory failure. Check the person's airway, breathing and pulse. Use ABC technique, ABC evaluation criteria. If necessary, begin CPR. Loosen any tight clothing. Help the person use any prescribed medication. Continue to monitor the person's breathing and pulse until medical help arrives. Do not assume that the person's condition is improving if you can no longer hear abnormal breath sounds such as wheezing. If there are open wounds in the neck or chest, they must be closed immediately, especially if air bubbles appear in the wound. Bandage such wound at once. A sucking chest wound allows air to enter the person's chest cavity, so it must be packed with a occlusive dressing. So here we see three-sided occlusive dressing with one corner opening. So this acts as a valve. It allows air to exit and prevents air entry. Such dressings are done when there is pneumothorax. Let's look at some cases to see in what type of assistance we may provide in case of respiratory failure. For example, case 1. A 50-year-old male suddenly looks distressed when eating dinner. His eyes look watery and face is hyperemic. He is able to respond vocally and he is feeling a constriction in his throat. So here we can see that his eyes look watery and his face is hyperemic, and this distress came after eating dinner. So we might think this could either be choking or it can be an allergic reaction. But if it's choking, the patient won't be able to respond vocally. So since he's responding vocally, we can assume that this is an allergic reaction, and of course hyperemic face and watery eyes says that. So what would be our best course of action? Here we initially ask the patient, are you okay, are you feeling well? If he is able to respond vocally, in this case we assume that the patient is having either allergic reaction or maybe this is due to a left heart failure. If it's left heart failure, of course it's accompanied by chest pain. So here chest pain is absent. In this case we assume that this is allergic response. So immediately we can give him anti-allergic medications such as corticosteroids, which I will show you in the next slide. Medications such as corticosteroids, for example, we see corticosteroid inhalers and corticosteroid tablet such as prednisolone, and antihistamines such as cetirizine hydrochloride. It also, of course, the patient may even be getting an asthmatic attack, so we can use bronchodilators such as Astelin, or we may use salbutamol solution which can be delivered through nebulizers. Of course we must call the emergency services. Maybe this may be exacerbation of asthma, or it can even be an anaphylactic shock reaction. So the emergency service will arrive and then they will evaluate the situation. Case 2. A child, 3-year-old, playing by himself suddenly falls unconscious. Breathing was abnormal and low-pitched abnormal sound was heard on expiration. Face looks cyanotic. So here we can see that it's a child and he has fallen unconscious. So immediately using ABC criteria we will check. We'll check airway with probably up to the level of pharynx, but that's not enough. Then when we go to breathing becomes abnormal, which means the blockage could be below the level of pharynx. Then we check for circulation. Circulation may the patient may have tachycardia, however circulation is not compromised. Then we hear this low pitched abnormal sound, could be stridor, so in which case we think that it's and a choking hazard. The child might have swallowed or inspirated a small object from the toy. In this case, if we have a stethoscope, we can hear bilateral sounds. But in this case, there will be unilateral stridor, because most probably it will go into the right bronchus and then cause stridor, it cause obstruction. Also look that the patient's face is cyanotic. In this case, we can assume that he's going under respiratory distress and about to face respiratory failure. So what can we do in this case? Here, if it's an infant, we can do back chest thrust and back blows. So the frequency is 5 back blows, where the infant is kept upside down, and then blows are delivered in between scapula. After 5 back blows, the infant is turned supine position to the opposite forearm, and then his 5 chest compressions are given, and then doing a chin lift maneuver, we check whether the obstructing object has come out. If it has come out, the object can be scooped out using finger, like shown in this image. However, if it's not so, until the emergency service arrives, we can keep repeating this procedure again and again. Also remember, since breathing is compromised, we can also give 2 breaths between 5 chest compression. This will help the patient to breathe better. Case 3. A pregnant woman who was eating dinner at a table suddenly feels distressed. She's unable to respond vocally. Abnormal sounds are heard in expiration. Patient is unconscious at the time of response. So here the patient is undergoing choking. She's unable to respond vocally, and she's conscious at the time. So in this case, we can do the following maneuver. It's called the Heimlich's maneuver. To perform Heimlich maneuver, the point is above the umbilicus. We will keep a fist and then perform upward and inward thrust to force out the object. If you are alone, you can perform the maneuver like shown in right side. However, our patient is a pregnant woman, so in this case, Heimlich maneuver can be performed by placing 2 arms of the care provider under the woman's breast and then performing thrusts until the patient spits out the object. Of course, if the patient goes into unconscious state, we can begin CPR and wait till the emergency services arrive. Thank you.